and I am a training manager at Healthcare Education and Training, and I will be moderating the webinar today. Let me first briefly introduce you to Healthcare Education and Training. HCET's mission is to provide comprehensive program development, education, and training to improve reproductive and sexual health outcomes. HCET is an organization of passionate people who are proactive in their belief that access to evidence-based, medically accurate reproductive and sexual health education, training, and care is a fundamental right. This webinar has closed captioning available. To enable them on your screen, click live transcript at the bottom of your screen and then click show subtitles. You can also change the settings by clicking subtitle settings. Both of our presentations today will also have subtitles going like you should see now. So if you have any trouble with that, just send me a message in chat and I can get that taken care of for you. So now just a little bit of housekeeping. For more information and to keep up to date with HCET events, please be sure to follow HCET on all of these various social media platforms and visit our website at hcet.org. For additional trainings and professional development opportunities, visit our virtual learning website at learn.hcet.org. Now, again, I'll talk about some housekeeping information. A link to complete an event evaluation will be sent to you via email after this webinar. Your feedback is greatly appreciated. Archived presentations and a list of upcoming events can be viewed on our website as well. If you have any technical difficulties during this presentation, please contact me at the email listed on your screen. If you are in the presentation and you have technical difficulties, please just send me a message in chat and I'll help you out. Nobody with the ability to control content of this activity has a relevant financial relationship to disclose with an ineligible company. Throughout the presentation, we encourage you to send your questions via the Q&A box. To submit a question, hover over the main screen, then select Q&A. There's a little icon at the bottom of your screen. Once you click that, a box should pop up and you can send your question. Please send your question to through the Q&A at any time, but we will probably be holding them until the end. We'll do a Q&A section near the end of the presentation. All right, so now I would like to introduce you to our presenters for today. So Janel Hebert is a public health nurse who has been with Eau Claire City County Health Department for over 16 years. Her area of focus in public health includes reproductive health, HIV, partner services, adolescent health, and communicable disease. Abby Hinz is a family planning nurse practitioner who has been with Eau Claire City County Health Department for over 9 years. Their areas of focus in public health span across adolescent health, healthy relationship promotion, sexual violence prevention, LGBTQ+ health equity, HIV partner services, and reproductive health. Gina Schemenauer is a public health specialist who has been with Eau Claire City County Health Department for over 11 years. She has worked to help coordinate the GYT campaign for several years. Without further ado, I will be turning things over to our presenters.
Good morning, everyone. I am just going to start sharing my screen here, so bear with us while we get this set up. Bailey, it looks like you have to stop sharing your screen. Perfect, thank you. All right, so let's get this going. There we go. All right. Perfect. All right. So thank you to HCET for having us. It's been...
It looks like we can't see your screen.
Okay, hold on. It says my screen is paused, but I don't know why. Let me try. Oh, resume share.
There it is.
All right. Can you see my screen now?
Now.
Yes.
All right.
Perfect.
Oh, it looks like there's a small box in front of it at the top.
Yeah. Is that better?
No. Oh, yes.
Okay.
Better.
All right. Oh, it's not letting me share presenter view, so we'll just go without that, okay? Can you see everything okay now?
There is still a little box at the top, but if you move that up just a bit more, it should be good.
All right. Good. How's that?
Just a little bit more.
Must be the bar there. You can move the bar. It should be a little yeah, there you go. Down.
Is that okay?
Yeah, that's good. Yes,
Awesome.
perfect.
All right. So thanks to HCET for having us. My name is Abby. Like Bailey introduced, I am a family planning nurse practitioner here with the Eau Claire City County Health Department Family Planning Clinic. And I'm going to get us kicked off today. So some of our background is that we have been with, hold on, still having some technical difficulties with getting now the PowerPoint to go forward.
There.
All right. So the Eau Claire City County Health Department Family Planning Clinic is located inside our health department, inside the courthouse. We have been participating with GYT for over 10 years. And so today we're just kind of hoping to share some of our successes and also our challenges. And this is just a fun little video we're hoping that you will find funny that we made a few years ago just to get us started on a kind of funny note. So let us know if you're unable to hear the audio or having issues. Well, maybe we'll be sharing this.
Replay. There you go.
Now this is a story all about how you get to our clinic and get checked out. I'd like to take a minute, so listen here. I tell you how to get to the clinic in Eau Claire.
In the Eau Claire courthouse on the ground floor, to the left of the bathrooms, there is the door. Checking in, sitting down, filling out forms, staff helping with the waiver, that is the norm. Then the nurse called me back and made it very clear. What you say in this room goes nowhere but here. I had unprotected sex and I got real scared. My friend said you're calling up the clinic in Eau Claire.
She tested me quick and took away my fears. Well, help with your service even after it clears. If you have more questions, now is the time. So I said birth control and condoms were on my mind. I walked out of the clinic feeling good about my health, and I yelled at the staff, "Yo home, check you later." I talked to my friend and it was finally clear. I found the best place to get services in Eau Claire.
All right. As you can see, we like to have a little bit of fun. I know that one is pretty cheesy and maybe a little bit dated, but it was fun to make and put together. So our overall goals for the webinar today is to really give you maybe some ideas for building community partnerships around GYT, some tips for hosting on-site and off-site GYT clinics, give you some more promotional ideas, including outreach events, swag, social media, and other strategies we've used, and then how to evaluate your GYT campaign. So starting with building community partnerships. So this is for us where we started with identifying who your community partners are. So for us, we looked at what our priority populations were. This could be based on local data, state data, just kind of following that. And then also looking really in your community and looking at your partnerships and seeing who are those priority partnerships and priority relationships that you already have. And then looking at those existing partnerships. So how can you leverage partnerships you already have? There might be different organizations you already work with that would love to partner with you on GYT. Looking at shared interests. So for this specific topic, what other organizations are working on sexual health or STIs in your community? And then partnering with them. And then adjacent interests. This is a little bit different in the sense that it's looking at what are the other topics that fit closely with sexual health, and how can we partner those two topics together and those organizations together to make it work for us. So in our community, these include like substance misuse and healthy relationships. And we've been able to tie those topics to sexual health over the past several years to really kind of just build different partnerships in a different way. And then once you've identified your partners, how do you work with them? So not every partner is going to be the same. You're not going to host a clinic with every partner or not collaborate on an event with every partner. There might be some partners that are just going to share your information. So say they'll put a flyer up at their organization that talks about your services. Or maybe you can collaborate with a partner to provide more education, more than just a flyer. That could be programming with the clients at an organization. So programming on sexual health or on STIs in particular, or it could be providing education to different organizations. So say you are educating staff at a different organization so that they're familiar with your services and then they can refer their clients. More in-depth partnerships could be collaborating on outreach strategies. So this could be hosting a table at a sexual health fair. And then obviously hosting a GYT clinic would be another partnership. So it's really looking at how can we partner with these different organizations we're working with and kind of what level of partnership, how involved can we get with that partner. And this really is based on just having that conversation with them, seeing what they can bring to the table, what you can bring to the table, and really how that best fits for both of your organizations together. So this is just kind of a list of what we identified as our priority populations in our community and some of the community partners that we were able to connect with to do different GYT activities. So a lot of our partnerships have really focused on youth and young adults, just because we know that's the population that is at a higher risk for STIs. And we are going to get in detail about some of these partnerships, but as you can see, we have partnered with our alternative schools, juvenile detention, some more peer-to-peer education type of youth groups. And then our young adults, we've really looked at how we can partner with the university, as well as a couple other programs. Our rural communities, we partnered with a rural family medicine clinic that serves those communities. We've partnered with Vivint and Scooters and the Chippewa Valley LGBTQ+ Center to provide more services and information to people that identify as LGBTQ+ in our community. We've done a lot of strong partnership with our domestic violence and sexual assault service agencies, including Family Support Center and Bolton Refuge House. And then people living with mental illness through Lutheran Social Services, their Positive Avenues organization, and then our Latinx community through El Centro, which is a community-based organization, and local churches that are really involved with that population. And then this is a list of what are some of those shared or connecting interests that have brought us to other community partners. So sexual health, you can see we've partnered with Planned Parenthood and the University Student Health Services here. These have been really great partnerships for us because we are trying to provide the same services. We've really tried to elevate that together because we just want people to get access to the services. We don't want to be in competition with each other. Adolescent health, I've kind of talked about what youth serving organizations we've worked with: HIV prevention, substance use and mental health, sexual violence prevention, and public health. So that's kind of a different one where we have actually partnered with other divisions within our own department and with other county public health departments on some GYT activities. So this is kind of the start. We're going to get in more in depth with what our partnerships have looked like. This is one that is very close to my heart. Outreach and collaborations with our AMT Health advocates. So this was a group of young people that were in high school that we worked with over the course of a couple of years to do different advocacy projects. So those were sexual health, healthy relationship, and mental health related. This one in particular was us putting together a promposal video during the month of April. And instead of asking their partner to prom, the ask was, go get tested with me. So we had a lot of fun putting together some really cheesy posters. And then we went to like a county fair and we filmed the video, which is right here, and I will share that so you can see how cheesy and fun it was. All right. And so another way that we partnered with the advocates was tabling at their high school during lunch. And that also was really fun. And they always had a good time doing more of that kind of peer-to-peer education in their school. Another partnership was through the Students Advocating for Excellence. That's the SAFE training. They do a training every year. That is their advocacy training. And so the last couple of years we've been invited to present. And this last year we actually used the GYT for High School Youth Workbook to kind of give them some tools to use and some advocacy tips on STI campaigns. They didn't end up using that. They didn't do a campaign around STIs. Their main focus and the way that these groups are funded is through alcohol and substance misuse prevention. So they tend to focus in on that, but I think we really still kind of planted that seed for them, and they actually had a lot of fun during our presentation. And so I think we will continue doing it and we'll continue planting that seed. And this was a great tool that I would encourage all of you to look into, was this youth workbook. It's on the CDC website. I think we might have put it in our references, or we'll make sure that you all get the link to that, because it does have a lot of good tools that you can share with young people that are wanting to do advocacy projects. Another partnership is with the Life Without Limits group. So this is a group in Eau Claire through the Eau Claire School District. They have had IEPs in school. They have a variety of disabilities, and it's a program that helps them transition into adulthood. And so over the last several years, we've really focused with them on that health transition into adulthood, including programming on sexual health and a clinic tour, with the overall goal being is that they will access the services they need and feel confident and comfortable accessing those services. We know that obviously accessing STI services can be intimidating for a lot of people, and really just wanting to give them the skills and the comfort that they need to be able to do that for themselves. We have done a lot of outreach and collaborations with the university here in Eau Claire over the past several years, and we've done it in a variety of different ways. We partner with the Race, Ethnicity, Gender, and Sexuality Studies program. They have a capstone where their students have to do externships, and so we have taken students for externships over the last several years. And as you can see in one of the pictures on the screen there, we're actually wearing, I think, the GYT t-shirts from several years ago while we were out doing a condom crawl. So during a condom crawl, we go to local college bars and we hand out condoms. And normally they're in a safer sex kit that includes condoms, our clinic information on STIs. Generally, it has kind of like a fun little like chocolate or sticker or something in it. Another thing that we have had students do over the years is create materials for us. So the Sexual Health for All image you see on the screen was actually a sticker that we got printed, and we've used it for outreach over the last several years since it was created. Another thing that we did with those capstone students was host sex ed trivia. This was really fun. We were able to partner with our local comedy group called Clearwater Comedy to have them co-host it to make it extra fun. The students came up with sex ed trivia questions. They got local businesses to donate prizes. And then both years, they also got other groups to come and do kind of like a sexual health fair before the trivia started. And so that was a really fun way to engage in a different way in education in the community. And then with our community, or sorry, with our collaborations with the university, we've also kind of tagged on to some of the events that they're hosting, especially for freshmen. They have an event called UW Meets EC where students come out and they walk all over the city and get to know different organizations. And we have tabled at that event every year, and it always goes over really well. They love the condoms, so that's always fun. And we try to have good swag that kind of brings them into. Another big thing we did was we met with Student Senate as a way to connect and figure out different ways we could get our services more known to students, connect with students on campus. And then we've also partnered with other student organizations, including the SWAT team, which is, I think, is Student Wellness Advocacy Team. They do a lot of different programming on campus, and we've been able to partner with them for different things like a Snapchat takeover that we did. And then the April STI Awareness Month, that was a flyer that was used on campus in like the bathroom stalls. And again, that kind of highlights how we just want people to get access to services. We don't care if it's through student health services, our clinic, or Planned Parenthood. We want them to know that there are multiple places where they can get sexual health services. All right, and I'll pass it along to Janel.
So we know where the switch us.
All right, so I'm just going to talk a little bit about this, about our partnership with McKinley. McKinley is a school that we have, we've been in the school district since I've been at the health department, so we've always kind of had a connection. And so McKinley is a charter school. So they have a lot of different components to their school. So they have a testing side where kids just come in and get tested. They have a credit side where kids come into classes. And then they also have the juvenile detention as part of this as well. And so one thing we've done is done outreach there. I will go in and do like some HIP teens, which is it's just a teaching session that we do with them like 5 different times. And then I offer testing after I meet with the student. So this has been a really, really great partnership. The school or the kids know that I'm coming, and I give out condoms in that school. And it's just been really great. And these are just examples of flyers that we have put up in the bathrooms or around the schools. Another thing that we do, because we like to keep things fun, is STI bingo. So we have had AmeriCorps interns over the years, and they've helped us. They're pretty creative, and they come up with some fun things to do. So this is just an example of STI bingo. Obviously, that's just one of the bingo cards, so not everybody gets bingo at the same time, but you can change things around, and I think we're planning to send a bunch of this stuff out. Yeah, this is just one example of something fun that we do to teach them a little bit about different STIs, how they can protect themselves, and different things. Thank you. So we also have worked really closely with Vivint Health, which is formerly the ARCW. So we go to Scooters, which is our local gay bar, and we do testing at the event with Vivint Health. So how we do it at the facility is the nurses will go with that work at the health department and encourage people to get tested. And then Vivint would be downstairs in one of the rooms, and they run the testing. So we can provide information when we're working with them or with patrons to get tested. We provide information, we provide swag, we can help schedule appointments if we bring our computers there. We make friends with people. We have a lot of fun. You just really get to know the people, get to know the bartenders, and just have a great time. The downfall to this is it is a late night, and I am getting old and staying up. I mean, oftentimes we are there till almost midnight, and then, packing up and driving home, and the next day for work is not always that much fun, but it is a great event.
Sorry, we don't want to make you dizzy here. So a few partnerships that I'll talk about. We have partnerships within our health department. So our family planning clinic is one piece of our health department. So we're coordinating outreach for all of our divisions throughout the summer, really is our busy time. We have a summer concert series that we're always active at, and we usually will pick a division or a program to highlight each time. So our family planning clinic really likes to go to this event. The one thing, we have to be a little careful with it. So we have a lot of families and kids that are there. So we really try to bring a few things. So not just family planning. We try to have, some maybe well water testing and maybe some, beach information for the kids and some beach balls. So having some other swag, because kids, when they see the tables, they want to come up and grab everything. And so we kind of keep the condoms a little bit towards the back, the fun stuff for the kids to the front. We've also learned we keep hand sanitizer away from the lube. A few different lessons that we've learned at that, but really it's a great opportunity to have that information there and really just make it feel like it's another topic that we talk about. So being very comfortable with it. We also like to have our family planning clinic nurses actually go. So Janel and Abby really like to go there, because then they're meeting with people and they're saying, yep, I'll be in the clinic. I'll be the one seeing you. So if that's possible, that's really nice to build that relationship and make people feel comfortable. We've also done outreach with other health departments in our region. And so we have a couple large music festivals that happen. And this is a place where a lot of high-risk behaviors happen. And so our health department contacted the music festival. We contacted the one in our community, and they said, no, we don't really want that information there. And so there was another music festival, and they were open to having us there. So we partnered with our Chippewa County partners, and we brought a ton of things. Again, kind of a variety of hand sanitizer, sunscreen, condoms, really a whole variety. And it was a good opportunity. I think the staff found that they were able to have some conversations with people. The one interesting thing they found was that people didn't know what female condoms were. And so they were opening them and showing them, and people really were interested and engaged with that. Kind of the downside is that it's a very alcohol heavy event. So just being aware of people coming in, and depending on how many drinks they had, the conversations would be a little bit different. I think our staff were very prepared to talk a variety of ways with people and educate. So for us, we were prepared with that. And we definitely always offered, here, take some condoms. Yep, share them. And we're hoping that we had an impact at the festival. Another local partnership that we have, I know a lot of you may have partnerships with your bars, or there may be a certain bar in your community that you think, yep, this is a great place to partner with. we found that going out and doing that individual bar contact is really helpful, but also we figured we kind of connected to this idea of connecting with our tavern league. That's a really good way to get connected with a large number of partners in a short amount of time. So it really minimizes the work that you have to do. So what we did is we just did some internet sleuthing, found out who our tavern league contact was for our community, called him up, had some conversations with him, went and sat down and just said, like, this is who we are. This is what we do at our clinic. This is kind of what we're hoping to partner with. And he invited us to come to one of their partner meetings. He gave us 15 minutes on the agenda. We just talked, we brought a bunch of swag and handed it out to the bars. And that was a really good way to increase kind of our reach at some of the bars. Some of the bars were like, nope, that's not what we want at our bar. That's not our clientele. We don't have those issues. And that was fine. And others were really excited. So our outreach with the Latinx community, our family planning clinic is really fortunate. We have an interpreter in our clinic who's really just close-knit in the community. And so she is connected, and if people need services, they know who to call and she gets them connected. So we have that relationship on an individual basis. We also have another group at our health department, health equity group. So this was something that was a little more loosely formed before COVID. And once COVID came, we really tightened up that group and utilized them as a messenger to get different messages out to our community, particular COVID messages at that time, but also being a resource about different topics such as family planning. And so we've been connecting with that group, and they've had requests to get information about reproductive health care. And so they've invited us to different events. One of them is a health fair that they host every year. And so we're going to that. We bring our interpreter and others who can speak Spanish. We bring materials in English and Spanish. And it's a really good time. We've also connected people and really had a schedule and wrote it down. Yep. Okay. Here's your appointment. And we've done some of that right on site, which is really helpful. It saves a few steps for our interpreters. So that's our big partner section. I know that's a lot of information to digest, but again, we'll send that all out and you can peruse through it. So we'll kind of flip gears here, and we're going to go into focusing on our GYT clinic, so the actual testing events.
So I'm going to start off and just talk about a few testing events that we did. One testing event we did was at Positive Avenues, which is kind of I guess I would call it like a center that people can go to during the day that don't have other places to go. I can tell you this, sometimes GYT events do not seem that successful. You may only test a few people. That's okay, but you get the word out, and that's what's important. One thing important that I just want to note about this is that we did advertise blood pressure checks and height and weights, and that draws some people in. Maybe there was lots of people there that didn't really necessarily have risk for STI testing, but they wanted to get their blood pressure checked. So that was a really, a coordinated idea, and I think it worked well. We did, I call this the university fail. We did a huge testing event at UWEC one year. I can't even remember, 2015. So this dates me. We did a testing event from 11 to 3. And I don't think we were prepared for what was going to happen. The email, and Gina, please jump in if you want to, because I know you were here too. So the email, I think, went out to everybody on campus, which is great. But holy cow, we had people lined up outside the door, people sitting around on the floors. I wish we had pictures. I don't know, we just couldn't find them. But I think we ended up testing from 11 o'clock to 3 o'clock. We tested 69 people. And we had, one of our bosses, it was so busy, she ran and got us coffee and granola bars. We were shoving our face full of food because we were starving, and we didn't think it was going to be this busy. And then we ended up having to tell people hey, come to the health department and get tested, because they didn't have time to get tested and we couldn't get them in. We really had to just evaluate this after we did this, because yes, it's a great event to test a ton of people, but it just was a lot. And again, this is 2015, so many years ago, and we have, changed our style a little bit. Bolton House testing event. So this is an event that I did. I went with a AmeriCorps volunteer. We just went to the Bolton House. Typically they do like education nights from like 5 to 8. And then you just talk about a topic and people attend. And so we ended up getting pizza for people that were there. It was actually really, really nice. A lot of questions. It was very like one-on-one with people. And we handed out one thing that people really like there is menstrual products. So tampons or pads, and that was a real hit there. We did have a patient or a person that ended up coming to our clinic to get an IUD placed, and we did test a few people there. So it turned out really good. One thing that really helped, or what we decided we wanted to do, but then again, COVID, you know how COVID interrupted everything, I feel like, was they wanted to continue to do this education like one time a month or a few times a year, and other like people at the health department would come and do a presentation. So we really thought that was a great event. We just have to readdress it now that we maybe have more time to do that. I think I kind of touched base on this. This was just a rural clinic that we did. Again, small clinic. We did it out in Augusta, which is, you know, outside of, it's in the county. Maybe not that many people tested, but again, a good way to get people knowing about your services that you do. So some suggestions for hosting a GYT clinic, I would say, is really keep list of supplies that you bring and how many supplies you bring. So then you can go back and look at it and like, oh my gosh, we like ran out of this, and then you can write that on there and then keep evaluating that. Snacks, we gotta keep your staff healthy and energized, and also snacks for people that are coming. I mean, that's a really great way to intrigue people, like, hey, come have pizza and get tested. I think I've seen things that people will say P for pizza. So incentives, anything like that. Have a runner. Having one person with you that is just there to help with anything that needs to be done. Maybe you need to make a copy of something, maybe you forgot something. And then also have a hot wash after, just to kind of go through what happened, what everybody thought, what were, you know, what were your pits and what was the best things about them. And then also just remembering it's okay to not do an offsite clinic. I know sometimes, like, you know, when you think about GYT, you often think about get yourself tested clinic where you're actually hosting offsite, but really you want to get people into your door. So figuring out what is best. Is it best to host a site somewhere, or is it best to go somewhere and give information and schedule people into your clinic and then get them in your clinic? So you really have to figure that out. And also just knowing the place that you're testing at and what the design is like, so you know, for confidentiality and things. Sorry, I'm talking really fast because I know we have a lot. So GYT promotional ideas. So this just kind of gives a little bit of an idea of like a budget, depending on how much GYT funding you get, what you can use for budget. So a lot of times we'll look at what swag we have, what stuff we have, and if we have stuff left over from the year before, where do we want to focus our money on this year? What do we want to do? So if one year we print a bunch of stickers, then we'll use them for the following year. Is there anything else about that?
Yeah, I think just to note, so this sample budget here, this includes some of our program revenue, so our clinics revenue. So it's balanced with some grants that we receive as well as some of our budget. So that's why it may look high or low to you, depending what your budget looks like.
So where do we find inspiration? Well, as you can see, we're pretty cool and pretty fun. So I think, you know, we actually really do have a lot of fun doing this. But so holidays are awareness days. Anything that you can find on the calendar, just go with it. Have fun with it. Make something funny up, whatever you can do, search it on the internet. Students, young people are smart. They are savvy. They can do research and find great ideas for you. So utilize your local colleges, your local high schools, if you want to get a high school group, TikTok, Instagram, all those things. Look at what other organizations are doing. Look at Planned Parenthood, HCET, they share a ton of stuff. go with what they have. And then also just brainstorming with the partners that you have, like Planned Parenthood, what are they doing, or other community partners. So these are Halloween. This is an example of Halloween stickers. I think Dunn County had some stickers that they had put together. Then Abby was like, loved them. She redesigned them so they would work for us. And then we printed them. And again, getting boned. I mean, yeah, we're pushing the limits a little bit, but I tell you what, that's sometimes what helps. People see that, they think it's funny and they like it. These are some other things that we purchased. We have a little tree inside of our waiting room, and every holiday we decorate it different. We decorate it for Halloween, we decorate it for Christmas. People take stuff off there, which is totally cool, I think. Pride, we have the poppets that you can see on there, the rainbow poppets. Those have been a huge hit for kids and college students that are teaching in the universities or teaching school age kids. It's a really great way to have something for everybody. St. Patty's Day. So again, something fun. We have safe sex kits that we give out. We throw a sticker in there, you know, a glow in the dark condom, something, and then go around to the bars. This is another thing we did, dry bags. So tubing on the river is a huge summer event. People come every single day when we go for walks. We're always watching people tubing on the river. I think they're crazy because I see fish jump out of that river. Not for me. But this way you could give them something, and they said protect your junk, get tested. They can throw their keys in there, they can throw their phone in there, wrap it up, clip it onto them. It was awesome. The fanny packs, people, we like we talked about before, there's tons of music fest or things that people go to. So that was a big hit, and we just shoved it full of different items and handed it out again at the river when there's people there, all different places. Here's some more ideas: GYT sunglasses, lip balm, keychains. We did some stress balls, so some eggplants and peaches, and we also did some water drops. And then again, like the lanyards, I think that is an example. You know, if you order 100 of them, they're probably about $3 each, is kind of what we ended up spending. These are just some magnets. These are actually pretty old now. Again, people still like them. AmeriCorps were people that helped with these as well. This was kind of probably our first, the condom Superman hero was kind of our first, like, ooh, we're going to put this on Facebook and what are people going to think? And I think it was kind of funny because people liked it and we got lots of hits on that. We also purchased a button maker on Amazon. The button maker, I think we spent about $200, and we use it for a ton of stuff. People, again, love it. We're going to be doing an outreach event at the university coming up on Monday. The students came up with "Don't be silly, wrap your willy," which I know we've seen before, but again, they're making a whole bunch of buttons and using it for multiple events. The bag of condoms that say your colors are beautiful, if you reach out to the state, they have safe sex kits that you can get for free, and they will deliver them to you, and they have fish bowls, or they will ship them to you, I should say. And so you can get those and then just put your information in them. We have condom carriers, again, stickers in there, whatever you design, and we'll be sharing with you a bunch of the designs that we already made, and you can change them to what suits your needs best.
One note about the safe sex kits, that's for the state of Wisconsin.
Oh, yeah, sorry.
I don't know what the other states do, but at least for Wisconsin, we have that option.
These were two probably swag fails. I would say we did do a phone back that you stick to the back and you can put your cards in there, and they said treat yourself, and they just weren't a big hit. And then some bags that we did, I don't know if it was the color or what it was. I mean, I'm sure people don't want to be carrying around a bag that says, you know, this is your STI, whatever. It's not just, you know, you. So that wasn't a huge hit. So just some fails.
Mm-hmm. And one thing I'll just say about the logoing too, we've changed our style. These were really probably 10 years ago, these ones. And so we've changed it a little bit where sometimes we'll have more of a QR code and not our information on it. Sometimes we'll just have our health department versus our health department family planning clinic logo, like the one on the treat yourself. So we've tried different things to figure out, because we know sometimes people will throw it away if it has something like family planning clinic on it. So we're trying to figure out how do we still get people to where we need them to be without kind of that identification.
And one more thing, we have Charlie the cart. We named them Charlie. And this has been a lot of fun. This is a picture of one of our, well, she's employed here now, but was an intern. And we load that up, we decorate it, we make it loud and proud. And I don't remember how much the cart was, but I believe we just got it on Amazon. It's been awesome. Condom dispensers, those are about $100 for the one. That's Abby's beautiful baby. That's Ophelia. So this design was to go up in wick. So, you know, you had a baby, you're not ready for seconds. Take some condoms, come in, see us. Also another thing, the condoms should fit like skinny jeans, not sweatpants. So we have that in our clinic room. We haven't changed it because it's been pretty popular.
We'll flip gears a little bit to social media as another outlet. So when we first started, as Janel said, 10 years ago, that our health department team was a little more conscious about what we were putting on. This was, again, one of a little more controversy things. I think we've learned just keep pushing that line a little bit because we did get some really good feedback on it, and we kind of kept moving it forward. So I think don't be afraid to keep pushing the new limits. And if it doesn't work, try something else. So one thing I will note about our social media, we post on our health department page. So we don't have our private family planning clinic Facebook page. We just have found we have a bigger audience on our health department page, and we just usually post 2 to 4 times a month with social media related to our family planning clinic. It depends. We sometimes, if April STD month, testing month, we're going to post a little bit more. So it ebbs and flows a little bit. These are a few reminders about social media. People love pets. If you can incorporate pets into your messaging, they love that. Be witty. So rhymes are great too. Again, using pop culture, viral memes, humor. And with this one, make sure again that your messaging and images are inclusive and they normalize all types of relationships, whether they're monogamous or open. This was something every year we do a wrap it up campaign. And so if you get tested, you get a free roll of wrapping paper. It was an idea we got from another GYT campaign at one point in time. We did add a little extra in this campaign this year. We had an elf at our health department. This is Fritz. And so Fritz was advertising our Wrap It Up campaign. So we did boost this post. It actually did get media attention. So sometimes our media just scrolls through our social media and they're like, oh, this is great. We'd love to do a story on it. So that's what happened with this one.
Abby did that one.
A reminder to use, again, a holiday humor, health holidays. So this one's a Halloween post. And then just a few other posts. These are some newer ones that we've been working on. Again, we've used Facebook as our medium. We've used Instagram a little bit. We do some advertising on it. Our health department has an Instagram account. We just don't regularly post at this moment. So again, using kind of that style is really helpful. So here's a few other advertising pieces. So we've done some dating apps on Grindr and Scruff have been a few different ones. We've had, with those, they're a little different. So I'll kind of compare how they were. We had some monies and we decided to try both of them out. So with Grindr didn't have any kind of budget requirement. We just deposited money in an account. You can start and stop your campaign whenever. We spent over probably a year, it was like $1,000. So we put some money into it because we really wanted to do some different testing. But we've spent as little as $100 too. So we found that you get a lot of impressions. So a lot of people seeing your ad, but our click rate was really low. So we had a daily average of like 3,500 impressions. So kind of people scrolling, but 1 to 2 clicks. So it was a little bit lower. So that's kind of the grinder piece of it. The scruff piece was a little bit more, they had more lines around what you could do. So you have to purchase a 7-day, you have to purchase, I guess, 2 1-week flights, they call them. And so with that, it was $1,500 for 2 weeks of advertising. That one we spent about it was about $50. Or no, wait, it was about 500 to 700 impressions with that one. And the click rate was about 5 to 7 total for the week compared to 11 on Grindr. So we really didn't get our money worth as much on Scruff. We thought that Grindr was more beneficial. With a radio ad, we did that quite a few years ago in 2018. Again, it was about $1,000. We ran an ad. We had a net reach of 16,500 people in our demographics. We did look at Spotify at that time, and it was a minimum of like $10,000 for advertising, which we did not have in our budget. We've also done bus ads, so looking at reaching a different demographic. With that, we spent around $1,300 on an ad. That can vary from whether you have a little ad inside the bus to a full bus wrap to an ad on the back. There's some definite options within that. So that was one way that we tried. We tried movie theater ads. So we did shorten our little parody video quite a few years ago for a 15-second ad, which was $1,200. The promo video, just again, several years ago was $850 to make. That was, again, just another strategy. We often just try things, see if they work, see if they don't. So that was one. And then lastly, we had Google ads that we do. So we've done those occasionally where we'll put $500 into it. Usually Google will send you some things and match you that $500. And basically once your budget runs out with the clicks, then it's done. So that's kind of a simple one. We didn't know that we found it super successful at the time, but I think it's something we want to explore again. Just a word to don't be nervous about traditional media. We really have found we try all strategies. So we do usually a press release. Occasionally we've done around like STI Awareness Month, especially if we've seen some of our data change. So we like to kind of track our, cases of chlamydia and let's see, is there anything happening? Do we want to have any messaging around this? So that's one piece of it. We've also done print articles. You can see on the left side around older adults and sexual health. We put that in a senior, the audience, it was a senior review paper, so really targeted at an older demographic. One thing we will note about TV interviews, they often want to get a B-roll of our clinic. And so just being really conscious again, that you don't have patients walking through. We want to make sure that that's a confidential and safe place for everybody. So we'll move on to our last section on evaluation. And how do we evaluate?
So this is just a form that we have in our clinic. So when we see patients that come into our clinic and they say, oh, I saw the ad about getting yourself tested or the importance of getting yourself tested, then when we send their test off to our Wisconsin State Lab of Hygiene, again, yours is probably different, we keep track of how many people we have tested for GYT, and then the data that we need to collect. We just have it back in our lab. We fill it out, we put it in an envelope, and then every couple months or so, I go in, pull them all out, and then put them into a spreadsheet. So this is just kind of what we do for people that come into our clinic to get tested, to keep track of our numbers, because that's important, and HCET will want you to report your data. Here's just some data collection as of January 2023. You can see, there was a 40% increase from 2021. 197 participants were treated. Again, lots of condoms distributed, total dual protection kits, 579. That is a little bit, I would say that data is a little bit swayed because dual protection kits sometimes, are you giving female condoms or insertive condoms, male condoms and Plan B, or just the condoms and Plan B? So just something to think about.
So we'll break it down just a couple different ways to evaluation of our GYT testing events like we talked about. There's a few different ways that we evaluated and we touched on all of these, but just kind of a reminder. So some of our outcomes that we were looking for, again, just as Janel showed that form, how many did we test? How many did we treat? How many did we enroll? And then just some outcomes on some of the communication methods that we use. So maybe it's pulling some social media information and things like that. Another way we evaluated, as we mentioned, was hot washes. So a couple more lessons learned. We've learned a lot over the past 10 years. Really, to tag on to events is the best way. To host your own event and get people to come is hard. And so look to see what else is happening, what's going to bring people, and then see if you can partner with that.
And one thing I would say too, just tagging on to that is the event that we do at the local gay bar is they have bingo that night. So that brings a lot of people in. Then we come in with Vivint, we tag on to that. And I mean, we have tested, I want to say 15 to 20 people a night, which is huge. So anyways, keep going, sorry.
Oh, you're good. The other piece is using trusted messengers. So just like Janel said, developing relationships with some of the bartenders, then they're going to say, hey, go see Janel and go get tested. She's really awesome. So using some of that messenger piece or bringing our interpreter to some of our Hispanic health fair, and then people are connecting with her and they're feeling comfortable to come to our clinic. So we don't always have to be the messenger. And I think that's one thing that our health department as a whole has learned throughout COVID. We are not always the best people to deliver it. So if we can get people comfortable and use that messenger, that's really key. Again, we say this all the time, be creative. I will say with one testing event at our rural clinic, we didn't have a lot of success with it. We were saying the youth, we were really trying to target youth. The youth weren't coming in to the clinic. They were needing to come at different times. It wasn't convenient. Some were worried about confidentiality. So there was a lot of different pieces to it. And one of the solutions we came up with was saying, okay, hey, how about you can help sign up for our family planning clinic services program through the state to get free services. Can you as staff at this clinic sign them up and just do that kind of that family planning and GYT within your clinic. And so that was a way we just provided some assistance with the application with staff and getting them comfortable with it. So coming up with an idea to help them do it themselves. So with outreach events, we have this outreach evaluation form, and we use this for our health department as a whole. After each event, the staff that go fill this out. They say how many people they interacted with, what did they bring, what would they do next time, would you do it again? This is something really helpful, especially at like the next year. We say, okay, this is coming up again. This is what we learned last time. And then other ways to evaluate some of your campaign. Again, we touched on this: social media, looking at your engagement, looking at reach. We've done some playing around on social media to see, is our Instagram ads better, our Facebook ads better? What if we boost a message for 4 days and then we place an ad with that same message for the next 4 days? What do we see? Do we see different results? We've also done, Facebook has an interesting A/B testing, so you can test different messages and see, you can basically, it places the two messages at the same time. Facebook will say, okay, nope, this one's actually performing better. And then they throw the other one out. So it's an interesting way to see what's resonating with your audience. And then lastly, looking at website traffic. So that's something, again, thinking after events, before events, kind of looking at what does your website traffic look like to your website. And then a note about QR codes. So we do use those quite regularly. I think a lot of people do at this point in time. I will say we did purchase a subscription to a QR code program. So you can able to get how number of scans, where they're coming from. It was nice, but honestly, the data we got back wasn't really great. We had so many scans from other countries, and I think they're really like, if it said we had 300 scans, in reality, it was 100. So it didn't really give us a good idea of what we're getting back. I think there's a lot of bots and things that happen in the background to kind of mess up with some of those numbers. So that's something we haven't found super successful. So we don't typically our prepaid subscription will run out and we're just going to use the free QR code generators. So we don't get that data of how many scans we're getting, but at least it's still out there in an easy way for people to access our webpage. So that was a lot. We thank you for listening to that. And we know we kind of rolled 10 years into one PowerPoint, and it was really a good experience for us to try to figure this out. But we just wanted to give you some ideas to really just be creative. And sometimes your strategies will go awesome and they'll work. Sometimes they'll fail, and that's okay. So really just, I think the sky is the limit. Take some ideas. What works for our community may need to be adapted for your community. So we're just hoping that we left you with some ideas, and certainly we are open for any questions. And even after the presentation, you can contact us too.
And we will share a lot of our designs and stuff with Bailey, and Bailey will send them out to you, and feel free to adapt them as you would like.
All right, thank you guys so much. I want to open the floor now to any questions. I saw some questions here in the Q&A. Can Abby, Janelle, and Gina, can you guys see the Q&A box?
Yes, we're just getting that open right now. So the first question is, when you guys did the GYT events, especially at the schools, did you guys help with FPAs? I'll let Janelle answer that.
Yes. Yep. We absolutely did. So our clinic is a little bit different. The Gina, her name is, she does pretty much everything. So basically, if I'm at the school and I have a student, I will call her and say, hey, can you look this person up? See if they have coverage. If they don't, then we'll just do an enrollment in FPAs and get them covered. And if not, if they qualify for, we are a Title X clinic as well. So if they qualify for Title X, then we will utilize that as well.
Thanks, Lorianne, for putting that in there too about the safer sex kits. So yes, if anyone in Wisconsin is interested in the risk reduction kits, you can reach out to Lorianne at the state. Okay, so next question. How do you suggest utilizing these local messengers from bars events? If you work at the state health department in Colorado, we are lacking on relationships with local orgs and community-based organizations. So that is a really great question. I think kind of going off what Janelle said was, it can be hard, especially if you're not local, because you really want to develop those like ground level relationships. So like when we go do events, we talk with the bartenders or on campus.
If you're not working, have a drink with the bartenders. If you drink, I mean, truly, have a conversation.
Yeah. So I think when you're further removed from the community, you're right. It's probably really hard, but I would say even reaching out to the local people, like the local health department, see who their connections are, who are the people that they work with in the community that are the trusted messengers, because they're there. They know who have been good partners, who have been good collaborators, who the community listens to. So yeah, I mean, reach out to those local health departments that are doing this work.
Sometimes if you talk to people like in clinic, like if you talk about what advertising you're doing or what things you're doing with patients, sometimes you'll learn like, hey, my friend's a bartender here, or we have a patient that said we taught them about insert of condoms, and then they took it to the bar and they educated a whole bunch of people on how to use insert of condoms. So you just gotta talk about things and find fun ways to spread the word.
Yeah. So the last one is related to that connection with schools, and we have also had a lot of resistance, and we really have just tried to find what ways. It's again looking at how can you partner with schools. So there are some schools where maybe we've just been able to get our information to those point people, right? So the school nurses, the guidance counselors, the health teachers, if they have our information, they can get that information to the students. So that's kind of one way we've, I'd say, reached just kind of the general school population. We've also had a lot of success partnering with our rural schools because they have less resources, right? They have fewer resources in the school, and so they really rely on the health department. And so we've had a lot more success there. And with Janel, the success through our alternative charter school, they're more open because they have students that are going through a lot of different experiences and maybe considered higher risk. They have been open and they have a little bit more leeway. And I know that is the same case for other alternative schools in our area as well.
And one thing to note with our relationship with the schools is, I mean, I've been at the health department for 16 years, and we used to provide all the school nurse care in the school. So we were the school nurses as well as public health nurses. So we did the diabetic plans, we did the tube feedings, we did all of that. So we had ins at our schools. But so like I have a high school, North High School, which is just like a normal public school. And there it's like taboo, like I can't bring condoms into the school, or I'm not supposed to, or I can't bring Plan B. So my out to that is I will meet with students and I will go out to my car and I will pull up on the sidewalk and they will come into my car and I will give them their condoms or whatever. And so I'm not doing it on school property, and that has never been an issue. We've had some issues with other things, but so sometimes we have to do things to get around it. Obviously, we're always talking to them. I mean, as you know, with family planning stuff, we're always talking to them about talking with their parents and different things, but sometimes we have to find ways to get around rules.
Yeah, I think finding some of those, not loopholes, but just creative workarounds. And then like, who are the champions in the school?
Yep.
And what are other ways to get your foot in the door? We do a lot of programming around healthy relationships, which has been a good foot in the door, which is a little bit less controversial, a little bit more acceptable to a lot of our schools. And so that has been a really great foot in the door, and building on that relationship that we already have and that programming we're already doing, we've been able to take it a step further and talking a little bit more about sexual health and STIs. So really kind of building on some of the other programming we're already doing in school has also been very, very helpful, I would say.
And the program we're doing in schools is, if you haven't heard, Safe Dates, which is a curriculum, and then also HIP Teens, and then is it 3 R's? So, you know, sometimes we teach those in the schools, and HIP Teens is one that has a whole unit on just condoms and using condoms. And so then that's a great way to have condoms in school. So any other questions?
I did see in the chat that Carissa posted a Linktree can track QR code scans. So that is another option to get that data from QR codes.
Yes, you're right. Thank you.
All right, I've always heard to wait 7 seconds to see if anybody has questions. So it's officially been 7 seconds. Any other questions or comments, please put them either in the Q&A box or in the chat, and we will get those answered. Like was mentioned, I will have a link to all of the handouts, and all the links will be sent in an email after this with the evaluation. So don't worry about getting those. And other than that, I am going to move on here. Thank you so much, Janel, Abby, and Gina. This was a great presentation. All right, so thanks again, and everybody will be getting an evaluation. Like I said, you can also scan this QR code here if you want to do the evaluation now, or you can wait till a link is sent to your email. If you enjoyed today's presentation and would like to continue your learning with HCET, please consider visiting HCET Virtual Learning at learn.hcet.org. New learning opportunities are being updated regularly. With that, please keep an eye out for my email with all of the handouts. But other than that, thank you to our presenters and thank you to everyone who has attended. We are ending a little bit ahead of schedule, but I would love to give you back this 15 minutes in your day. So have a great rest of your Wednesday.
Thank you.
Thank you.